Hello guys, alright everyone, welcome back. I'm Dr. Sangwa Patrick, and today we are diving into the most medically questionable yet also hilarious moments from Mr. Bean, from hospital to the dentist to the operating room. This man has broken every rule in the medical book and somehow survived to tell the tale. And don't worry, I'm going to tell you exactly what he got right and what he got wrong and what would actually happen in real life if you tried. There's a chance he did. Spoiler, don't try any of this at home unless you want your doctor to give you the same face I give my patients when I when they say I Googled my symptoms. Don't Google use the symptom to see the diagnosis if you're not because it will mislead you. So meanwhile, we are going to discuss or we are going to react to the hilarious Mr. Bean medical scene. Probably have you ever seen Mr. Bean acting as a doctor in different video in different movies? So now we are going to discuss different scenes that has been done by Mr. Bean. So for the second one, this is where I say good night, Mr. Bean. Hospital waiting room. So he was on the hospital waiting room. So Mr. Bean drives up, blocks the ambulance, skip the cake, annoys patients, and takes his temperature. So first off, blocking an ambulance is the fastest way to get every nurse in the hospital to hate you. There's a silence. They are not for decoration. They mean someone's life is literally in danger. So, if this happened in real life, security would have Mr. Bean out of that parking lot faster than you can say blood pressure. Secondly, taking your temperature in medicine, we can't tell when the reading is fake. So I have had patients drinking hot tea before take their temperature. Yes, it works for about 3 minutes. But trust me, it's easier to just tell your doctor what's wrong instead of playing medical hide and seek. So the medical point on this in real triage to the hospital, we use the S system, the emergency severity index in forward. A, S, and I, emergency severity index. So to the set who is seen first, cutting the line might make for good comedy, but in real life, it can cost lives of people, not the animals. So this is why what Mr. Bean was done or was acting is not real. Let's see the second scene of Mr. Bean. So this is happened in the film that has been published in 1997. So in the operating room. So the Bean is mistaken for a surgeon and removes a bullet. So do you think what is it? Ah, so bad, so bad. Okay. So first the red flag. So the moment you see a surgeon walk into the OR without scrubbing their hands, you know you are in trouble. Nobody wants a real surgeon as you do. Enter in the operating theater. Have a first to wash his or her hands and then put the gold in a sterile manner so that he can touch in his face, he can touch his mask as Mr. Bean was being done it in the theater. The real surgeon can't do that. So if you see a surgeon like Mr. Bean, you are in trouble, you are in danger. So that's not even proper putting of personal protective equipment. Where is the mask? Where is the grooves? It doesn't have the grooves. So this is not a case anatomy. This is a recipe for post-op infection. So it means that this way the Mr. Bean was behaving will increase the risk of infection to the patient. So the medical point here in real life, removing a bulletin is not just a pull and run and done. No, if someone was having a bullet in his body, to remove it is not easy. So we worry about bleeding, nerve damage, infection, and even internal injury. Internal organ can be injured. And yes, sometimes we leave the bullet in if removing it would cause more harm than good. So someone can arrive with a bullet inside because the surgical procedure for removing it was not possible. This happened in real life. Let's see the third scene of Mr. Bean. That is the visit. So Bean messes with the dental chair, plays with tools, and exercises himself. You think this is real? Ah, no, it's not real. How can you do that when you are sick? So don't do that practice. You can't even get anesthesia to yourself. It's not possible. Ah, yes. So the classic dental said, first, he will press the chair like it's a roller coaster ride. In reality, dental chairs move slowly. So your dentist is not trying to launch you into orbit. Second, being giving himself a shot of awkward anesthesia. That's not how you numb teeth. My friend, that's how you numb your tongue, your rib, and possibly your career. So the medical point here is that anesthetic overdose is real can happen but and in the mouth can happen. So you can block your airway if your tongue swells. So funny for Mr. Bean, not so funny for the emergency room doctor who was to save you. So the fourth set from Mr. Bean, the eye test. So Bean cheats here, the eye chart test. Okay, so Mr. Bean memorized the chart. Pro tip: ophthalmologists charge the haters randomly for his exact reason. So if you want to pass an eye test, the best way is still actually having good vision. A visionary consult, I know. So the medical point here, vision check are just for reading. They catch serious conditions like glaucoma and diabetic retinopathy early. So no comment there, just it's life saving career. So don't do what Mr. Bean was doing. So the fifth sentence from Mr. Bean, accident and first aid gun. So Mr. Bean hits injury with creativity using a teddy bear as a sprint. Impressive if the patient is also a teddy bear. So real first aid, control breathing if pressure, immobilize fractures, and call for professional help. And for the love of medicine, no sticking random objects in tools is not recommended. So the medical point here, basic first aid knowledge saves life. Knowing CPR is kind of pulmonary resuscitation, wound care, and how to treat burns can be the difference between life and death. So, by ending that, what did we learn from this? So don't block the ambulance. If you are a medical student, if you are working to the hospital, don't block the ambulance. And even don't fake your vital sign. And even don't operate without training. You can't do that. To be a surgeon, it can take someone to study in the medical school more than it's better than 10 years or above. So don't operate without training. And don't copy Mr. Bean unless you are in the comedy sketch, but not in real medicine. So medicine is serious, but sometimes laughter is the best medicine. And I have to say, watching Mr. Bean, Ben, and Brick, every medical rule was the healthiest laugh I have had all week. So Mr. Bean was was so dodgy. So if you enjoyed this, hit like, subscribe, and tell me in the comment which Mr. Bean said should I react to next. Maybe next time I will tackle his trip to the swimming pool or to the turkey on the head incident. Thank you for watching. Subscribe. Bye bye.